Good afternoon, everybody. Welcome to the Safety Net, Brookline Interactive Group's show dedicated to educating the public of Brookline and elsewhere about domestic violence. I'm Susan Howards. I'm a domestic violence attorney in Brookline, and I've been doing the show for a couple of years now. The content of the show is ours, myself, and our guests. It is not Biggs. But today we have two very, very special guests, at least very special to me because I know so little about the role of public health. I really never paid attention to public health, shame on me, until COVID hit. With us today is Sigalle Reiss, our Commissioner of Public Health. Welcome, Sigalle. And Elizabeth Bennett, who's our public health nurse. Hello, everybody.
Hi, Susan. Great to be here.
Sigalle, would you tell us a little bit about yourself? You have a rather impressive background.
Sure. Thank you. And thank you for the introduction, for having us here today. We're really excited to outreach and share about public health because we obviously have a very strong passion for it. As you said, I'm the commissioner. So I serve as a commissioner of public health here in Brookline. Just the structure of government that we have a statute that institutes the powers of public health authority to commissioner. So it's one of the reasons why I was excited to come here and to take on that role. And I do work very closely with our advisory council on public health when we think about policy and community engagement. So they're a very strong partnership and collaborator that we have. But for my bio, so I've been in public service for probably close to 20 years. Started as an inspector down in the city of Taunton doing health inspections. Moved my way up, went to BU, got a master's at the School of Public Health at BU. Back when they had the Community Scholars Program. So they had a program where people in public health could go at night for half the price, which was a huge bonus for someone that was really working and trying to pay their way through grad school. So
we know that, yes.
Yeah. Fortunate to get my MPH from BU, and then soon after that, got a position as a director in the town of Norwood, where I served there for 15 years, and as a director of public health, a smaller department, but similar type of work. And then this opportunity sort of presented itself, and I was excited to try a new adventure and new challenges. I've been here about a year and a half. It was the end of February of 22 that I started. So still learning a lot, relying on the great staff we have here to teach me, the ins and outs of Brookline, but excited to be here and excited to do work like this.
Well, welcome. We're glad you're here. And Elizabeth, you're our public health nurse.
Yes, I've been here in this role for about 2 years now. Prior to coming to Brookline, I was working on an intermediate medical step-down unit at Brigham and Women's, and worked there for about 5 years. Prior to COVID, we saw really a little bit of everything on our unit. Specifically, we treated a lot of patients with acute medical diagnoses related to chronic substance use. So that sort of really sparked my interest in that area of nursing. And I pursued my certification in addictions nursing just as we were sort of getting into the COVID-19 pandemic. My unit at the time transitioned to a COVID floor. So I sort of had that inpatient experience for about a year and a half before coming to Brookline. And during the pandemic, I completed my master's in nursing with a focus in global and public health. So that in combination with my background in addictions nursing really heightened my interest into coming more into the community. And learning more about how I can help residents of Brookline sort of at a level prior to their health escalating to a point where they need to be hospitalized. So it's been a great experience so far, and I've had an opportunity to do a lot of different things since I've been here. So
I'm going to start with Sigalle. COVID-19, how did that affect your work here in Brookline?
Yeah, so I would say, as it has affected our society in general and had really big impacts across sort of, I call it the ripple effect across many sectors. Obviously an impact on us being sort of the lead response in communities, boots on the ground, really working on those isolation and quarantine, community engagement and education. And I always said one of the main challenges for us was really communicating to a wide variety of views out there in a constantly changing environment. So I recently was able to hear the former CDC director speak about the CDC's role in communicating about COVID, and how we said, we're always going to follow the science. We, I meaning public health, the big public health, national public health. We're always going to follow the science, but really didn't communicate well that the science was always changing and we were learning things. So extremely challenging for public health to constantly be putting out public messaging in an environment that kept changing, and keeping that reliability and that trust, and really for local health departments being that contact on the ground. I would say, communicable disease response is one of the many buckets that we work in. I would say it's one that people didn't know that much about probably before COVID, like you kind of said.
That's right. Yeah, yeah.
People know little bits of what a health department does. I always say, like, the interactions they might have, like a restaurant knows our regulatory enforcement and food code. Right. If you call about a housing complaint, if you have a mold in your house, or something not functioning, or something broken in your house, you might call a complaint for a housing inspection. If you see, I'm sure we'll get into it, if you might see some rodents or some solid waste violations.
Next on your list, rat activity. Go for it, Sigalle.
Yeah, I'm sure we can't go through an interview without talking about rodents and rats, but hopefully we'll get to that in a little. But just the big picture, people might know little bits of what a health department does. But I'd like to just take a step back and talk about sort of the big picture, what a health department does. I kind of see it as, it's based on the community and population level health. So we're not really talking about individual diseases or interactions. It's more community wide. So we deal a lot with the field of epidemiology. So looking at statistics about what's the health of the community, what in the community can we do to change the environment to create a more healthy community. So it's really looking at that population level, which tends to be a little more abstract. And I think we saw some of that struggle during COVID, because people would say, well, what should I do to protect my health? And that's really something you want to talk about with your healthcare provider. But what we're out there doing is, as a community, this is what we should all be doing. We should be masking. We should be staying home when we're sick. So they're more community strategies. And I think, again, in our society, we tend to be very individual focused, in that I control my destiny, which to a point you do, but understanding the environment and the community you live in have a very strong effect on your health. And I think, we've seen, I don't know if you've seen, but a lot of studies out there that where you live, your zip code is the strongest indicator of your health outcomes. It's stronger than your health care that you receive, stronger than your genetics. It's actually where you live. And I talked about why I was excited to come to Brookline. Brookline is actually a very healthy community. When we look at our statistics, when we look at our health indicators, and I know another topic that I hope we have time to get to is talking about the community health assessment that we're launching. Brookline is a healthy community. We have walkable streets. We have public transportation. It's not perfect, but that
it's not our fault. It's not our fault that it's not perfect.
Exactly. It's a desirable community because it's a healthy community. The things that make it desirable: good education system, walkable, easy access to healthcare, all those things that make it desirable also make it a healthy community.
I'm going to ask you a question. When you say that we're a healthy community, and I'm a domestic violence attorney, do you factor in domestic violence to whether a community is healthy or not?
Yeah, and I would say things like human services and social determinants of health are going to be indicators that we look at to evaluate the health of the community. Now, when I say we're a healthy community, what does that mean, right? It's a very general term. Looking at our statistics, we do tend to be healthy, and thinking about chronic disease or communicable disease. But there's always going to be disparities, right? So that's where we really want to get down to. And like I said, in our community health assessment, we might look at, across the board, and you probably know this information better than me, what are our rates of domestic violence? Is it higher or lower than the state? I don't know that. But then when we break it down as socioeconomic class, along race lines, race and ethnicity, where are disparities? Because as we know, not everybody gets the privilege and experience, it has a similar privilege and experience.
So now, let's talk a little bit now about your community health assessment. Will you include domestic violence as an area that you would look at? Because I know many of us would really appreciate it if you did, so we'd have some hard evidence.
Yeah, so we're working with Health Resources in Action. Most of it will focus more on disease rates, but there is, like I said, with social determinants of health, looking at mental health, at human services. I think another bucket of a project that we're doing might look more at domestic violence, because we're also looking, as I heard right when I got here, that the town had a strong interest to really beef up human services. Now, we're technically public health and human services. Our delivery of human services in the department, the specific department, is very little. We have some work we do with the schools, but as far as what we deliver from the public health department is very small. There are other departments like the senior center, the police department,
Police, yeah.
in the schools that have a much more robust when you think about social workers and human services. So what I kind of, in talking with the new administration, the first question I have to ask is sort of what's out there and what's available to residents. And then what is the gaps? Where are the gaps? So not necessarily what are the needs, but what are the human services systems out there already? And Susan, you'll probably be on that interview list as we try to understand what are the domestic violence services out there. And why
I'm going to jump in and tell you we have a fabulous, really fabulous domestic violence department in our police, really fabulous. We had I'm going to be really blunt because I've been all over town blunt. We had a wonderful, wonderful program put together by the police, a curriculum that was in the schools. I don't know if you've heard of this or not. In 2020, that was part of the school resource officers. The SROs were just pulled overnight out of the schools like that. Parents didn't know, nobody knew. As a result, the curriculum was pulled. And I met along with Rita McNally, who's chair of the Domestic Violence Roundtable, which is out of Norfolk County. It's D.A. Morrissey's. We met with I think the associate superintendent for curriculum a few years ago. She's no longer there, and she was lovely. And we asked her what's going on with the domestic violence, because there is sexual harassment in the schools. There is sexting. There is trafficking in the schools. We're kidding ourselves if we don't say those things out loud. And so she pulled out what was replacing this fabulous curriculum that our neighbors use, okay? And we're not using it. And it was a 1999 public health curriculum. There wasn't one mention of domestic violence. And I didn't want to put this particular person on the spot, but I was shocked, absolutely shocked. And I think slowly they're working their way back, but the police department is no longer really in the school, and the curriculum was just incredible. So it's just something for you to know and keep in mind. I don't know. I know that that's how I met Elizabeth. Are you there, Elizabeth? I met her at this elder, I don't know what you call it, the elder group at Hebrew Senior Life, Elizabeth? I don't know what it's.
Yeah, I think they're referring to it as the multidisciplinary team meeting.
What does that mean?
So I think it's bringing in, stakeholders from multiple different groups around Brookline who have, an interest in responding to issues specific to older adults in Brookline. So there were representatives from the Senior Center, Hebrew Senior Life. I believe the Brookline Bank had representatives.
Yes, that's how I got there. Right.
Yeah. So a lot of different people coming together to share ideas that they have, or, collaborate on different programs that might be going on in town.
And I know that we're getting a little bit off topic, but a couple of years ago, there was a hoarding committee. I don't know if there's still, because I was on it, because I was of counsel to Hebrew Senior Life about 4 or 5 years ago. And there were some hoarding issues. I mean, serious hoarding issues of residents of Hebrew Senior Life. But I have to tell you, in my role as an attorney, elder abuse is the best kept secret in this town. The best kept secret. I don't know what we can do about it. I don't know how we can get people to feel comfortable reaching out to you or Sigalle or the health department or attorneys or the police. I don't know. But anyway, I'm jumping all over your list and I didn't want to do that. But I hope you'll include elder abuse and hoarding in whatever assessments you're doing, because it's very serious.
Well, I think that's, we're jumping around because I think it gets to that bigger picture, which is human services is all interconnected. And that if you have housing instability, you might have food insecurity, there might be domestic, that all these things tie into each other. So right. That's why I think, and what just happens to me, at least on like a weekly, monthly basis, in that I hear about an amazing program. Some I know about, some I don't, in either something is happening or it used to happen. And again, it gets to this why I want to do this assessment, because And what I hope at the end of the project is that there's some recommendations for the town, whether it be, and I think the hoarding example, it does still exist. It's a great program. It brings together the senior center social workers and our inspectional staff, which I say sometimes we are the cause of housing instability because we have to enforce some health regulations out in the community, and we don't want to do that unless there's supports in place. So it really brings in that interdisciplinary team, and it's a great example of how we can be collaborative to solve problems. How can we do that in more arenas? And how can we bring everybody together, whether it's a spoken wheel type of program, or whether we contract this out, or whether we build up human services in the town? So that's what I'm hoping we get to, because I think exactly the conversation we just have is how intertwined these things are.
How long do you think this assessment will take before you can share your results? Because I'm sort of,
That's always a question.
Yeah,
I wanted it yesterday.
Yes.
That never happens. So, you know, I think from when I got here to when I realized that this was, I think, the best path forward, I'm sorry, I just got locked out of my document. It took us a while to get here. And then going through a procurement process, I do think it's a very large project. We're going to bring in an outside consultant to do it. Fortunate that we're going to have some excess COVID funds to support this work. But I do think we're going to probably go out with an RFP beginning of the fiscal year, so in the next month in July, but that the whole assessment, I hope, will take about a year. So this time next year, I hope to have some recommendations for the town. And then, you know, then it continues some of these challenging conversations. You know, we're thinking about tight budgets and what departments are going to be involved and how can we cross collaborate? How can we create maybe some efficiencies? How can we tie together maybe some things out there in community nonprofit work to support this? Because there's a ton of it out there. There's amazing things going on. How can we tie it all together?
Wow. So that leads me into the rat problem. The rat problem, which is I live in Coolidge Corner. My office is on Washington Street. I haven't seen rats in the town hall, your area, but here in Coolidge Corner, oh my God, it's like rugs at night. It's like the parking lot behind the Coolidge Corner Cinema. It's just a rug, a moving rug. What can we do about it?
So I always start out my rodent conversations by saying it's really hard to measure our effectiveness. We obviously know that there's a problem. We don't really know where the baseline is, and we're all, you know, we're in public health, we're very data driven. So we want to be able to show improvement in the work that we're doing and the strategies that we're implementing in the community. But with that said, I would say I have heard sort of anecdotally few lesser complaints this year than last year, and we're starting to track that data over time as an indicator. But definitely understand that there's a problem out there. The town implemented, really want to thank, before I go into talking about what we're doing, because it's really a collaborative effort between our department, Public Works and Commissioner Galantine and her team, and the building department with Charlie Simmons and Director of Public Buildings. So really it's those three agencies that come together. We have the rodent task force, which involves more staff than just those three, staff from all our departments. And we developed the rodent action plan. And we've been implementing that plan. I can go through sort of what that means.
Yes.
So there's some short, midterm, and long-term goals in the rodent action plan. With town meeting just finishing, they have actually approved some of the long-term plans, which did include additional funding that was part of the override. Things in the plan include contracting with Modern Pest to have these, we have pest control boxes throughout the community in the hotspots. There's a lot in Coolidge Corner.
Right.
It is actually, we've contracted with Burger Food Safety. So what we're doing is increasing our capacity for solid waste enforcement at food establishments and really looking at what are the contributing factors at some of our food establishments and how can we lessen those things. So whether it talk about harborage in the restaurant or, you know, taking out their trash at the right time, keeping their dumpsters rodent proof, which is an ongoing effort. It's not something that they just fix and then it's done. You have to monitor it and make sure that that dumpster stays rodent proof, meaning there's no chew marks, that the lid fits tightly, all those things. So those are two contracts that we're doing. We also, talking about data, have redirected all of our complaints to the Brook Online system. What this does is one of our major challenges, believe it or not, was the flood of complaints coming into various departments. And sometimes we'd have a similar complaint at multiple departments, and then we're all running around doing the same thing. When we really wanted, we consolidated it to Brook Online. and then it's fed to different departments from that system to respond. So if it's a food establishment, it goes to public health. If it's a residential trash complaint, it goes to public works enforcement. If it's in a public building, it goes to the public building facilities department. So that has created a lot of streamline internally for us, which allows us to respond more efficiently and quickly out to the site and to help the public.
So now I have to tell you, it's working. There's a lot of restaurants in Coolidge Corner, but there's one, I won't name it. And the alleyway behind it was just a mess. And I noticed today there was one of those big, I don't know, they look like a railroad car where people throw, when they're redoing their house, their junk in. And the alleyway was spotless. So you must be doing something right. However, right next to it is an outdoor eating section that's a mess. And maybe offline, I'll tell you which. I'm not going to file a complaint, but I'm seeing little signs that somebody is taking the time to care about what's going on here.
Yeah, and I mean that's another good point. Talking about why we have seen an increase in activity. Rats have always been here. They're in different places than they used to be, and all the experts. It's I call him the Fauci of rodent control. But he works out of New York, and of course I'm blanking on his name right now. I apologize, but he's the expert rodentologist, and he's based out of New York City, who, as we all know, has quite a rodent problem, but all urban areas do. But talking about things like outdoor dining that are contributing to this, climate change. Look at the mild winter we just had. That puts a lot less stress on the population over the winter months. So we would expect to see more activity, more reproduction during winter, when usually reproduction slows down in rodents. So climate change is definitely playing into this also, but things like outdoor dining, changes in our behavior over the pandemic, where we had more residential waste, less waste in our downtown areas. So what happened? The rats chased food. It's all our activity that the rats respond to. We're sort of the reasons why. How can
you stop people in their residences? How can you get them to pay attention to their waste? Because I see people, they just throw things on the sidewalk. I happen to say something because I'm older and I really don't care. And I say, pick it up. You want some rat coming down this sidewalk? But how can we educate the public that they have to be a little more vigilant? They can't all be town done. Well,
we're doing it right here. We're talking about it. And I think, we talk about it a lot because it's definitely a hot topic here. We've put more information on our website. And when we do go out and find a problem in a neighborhood, we have little door hangers that we put out to give people specific information that they can do on their property to help reduce what we call harborage, which is conditions that either feed or house the rodents. Wow. So yeah, I think, public awareness, we can always do more, but it definitely has to be a community-wide effort if we're going to have an impact to reduce the population. Yeah. But unfortunately, rodents are a very successful species. They were here before us. They will be here after us, and we're going to do our best to control the population that we can in our urban areas.
Well, it even affects your pets. I have a little dog, and I have to give him a special shot. He's getting it in the beginning of July. I forget the name of it, because of rat urine on the dog parks. And yes, I'll get the name of it for you. We've been doing it for 3 years, and I don't take my dog to a dog park. He goes to daycare because he's so unfriendly. But every year, and it's like a $60 shot for this. Lipo something or other it's called. But anyway, Elizabeth, I'm going to switch to you. I'm going to go right into mental health because, quite frankly, I think rats affect our mental health. I really do. I saw a dead rat in front of my condo on Winchester Street. I almost had a nervous breakdown. And I didn't pick it up. I went and got my super and I said, could you help me with this, please? He said, absolutely. Anyway, let's talk about mental health in Brookline. How do you assess the mental health of a community, and can you?
Sure. So we work very collaboratively with a lot of different groups in Brookline. We have a lot of community partners who we rely on to sort of inform us about what's going on in the town. We work closely with the schools, especially. We work closely with the senior center. And part of our community health assessment will definitely involve mental health. The Surgeon General just recently came out with a new advisory talking about the effects of social media on youth mental health. So, that's something we've been paying close attention to. And I think one of the most difficult things that people are facing today is just the availability of resources to treat mental health and knowing where to turn to, when they're facing mental health challenges. The state did just release a new behavioral health hotline. So it's a great service. It's available 24 hours a day, 7 days a week, including holidays. They have both a chat feature online, a phone number to call, or you can text them as well. And it connects you with trained professionals who will assess whatever your mental health needs or substance use needs may be, and then they direct you to resources. So it's free to anyone, regardless of insurance status or anything like that. They offer translation in over 200 languages,
Wow.
including American Sign Language. They also have resources for people who are deaf or hard of hearing. And so they're really accessible, and they do a great job of assessing what the needs may be and then directing people to resources that are available to them in their area. And in addition to mental health and substance use, they also assist people with questions surrounding social services or needs that they may have in that realm.
Do you happen to have the number?
I do.
We could post it maybe, but we could say it here, but maybe Wes could post it for us.
Sure.
That would be certainly helpful, I think.
Sure. So the website, if you're interested in the chat feature or just any additional information about services they offer, is mass, M-A-S-S, helpline.com. And then the phone number is 833-773-2445.
And that's a resource hotline. If you call up, they will direct you to where you should go look further, correct?
That's right. Yep.
Okay.
So that's sort of more statewide. And then in terms of local public health and what we can do, we're actually in the process of getting ready to launch a new harm reduction program through the health department. So beginning this summer, in July, we're going to be offering naloxone at the health department, along with, it will come with a kit, which will include a card to that behavioral health helpline number. It will also have fentanyl test strips and 2 doses of naloxone. So it will be available to anyone to walk in during business hours. We'll do a brief training and then distribute it to anyone who needs it. We're also going to be working with community partners to do trainings with specific groups around town. So we'll be doing one at the senior center, one with the school nurses, with our MRC and CERT groups, and various other locations. And then it will be widely available to the community through the health department.
That's fabulous. That's really, really fabulous. I hope you'll do the same for domestic violence in the near future. There is a new program that's called a Call for Change. I don't know if you or Sigalle are aware of it. I'm aware of it because I do defend batterers in addition to dealing with victims. And if you have the feeling that you're going to abuse somebody, whether it's mentally, psychologically, or physically, you can call this number. It's not really a hotline. And they will stay on the line with you, whether it's 6 hours, 8 hours, and talk you down. And their calls have gone up 500% since it started. Wow. So maybe, it's something new. It's something novel. I think we're the only one in the country to have this in the state, but it might be something you want to look into, and it might be a model for other issues that you're dealing with, because you're dealing with some heavy issues. What is arbovirus? I don't even think I want to know.
So this is something we like to talk about, especially as we're heading into summer. So education around tick-borne and mosquito-borne illness. So, as we're getting into the warmer weather, people are outdoors more. We do see an increase in tick and mosquito activity in the area. So we like to remind everyone, with those insects can come illness. And so it's important to know how to protect yourself and what you can do to prevent being exposed to ticks and mosquitoes throughout the summer. So
what can you do in Brookline? I didn't even think we had ticks in Brookline.
Yeah, so any woodsy or high grassy area, you could encounter them. Also, if people are traveling, like to the Cape, Martha's Vineyard, they tend to have higher instances of tick activity there. New Hampshire, same thing. So just important, like if you're out hiking or gardening, things like that, to do a tick check before you go inside. So areas like behind the ears, armpits, where they tend to sort of latch on. And then the best way to remove them is using tweezers to just pull them straight off. And then in terms of like other ways to protect yourself, just if you're going out in dusk or dawn, trying to wear long sleeved pants and shirts, just loose long sleeve clothing to protect yourself, using approved tick or insect repellent, so things that include eucalyptus of lemon oil or DEET,
right?
or to read
DEET's good.
those labels carefully. Yeah, just to make sure you don't want to use it on young children and babies under 3. And then checking your pets as well, making sure if your pets are out in high grassy areas, especially dogs, making sure to
Right. Yeah.
on them as well. And then in terms of mosquitoes, just making sure you're eliminating, same thing with, insect repellent when you're out in those dusk or dawn hours, and then also eliminating any standing bodies of water that might be around your home. So like flower pots that may collect water, they tend to be.
Wow. But does Brookline spray, Sigalle? When I was little, I grew up in Brookline, we used to spray here. We never had mosquitoes. We don't spray anymore, huh?
Well, it depends what type of spraying. No, there's no aerial or ground spraying. We do larvicide basin treatriments, and that
What
we
does
work
that,
with.
what does that mean?
So when we think about water basins, like catch basins and things like that, they do treat with a larvicide, and that's through the South Middlesex mosquito control. But yeah, no truck based, and no, obviously no aerial spraying. They really they only do that in extreme measures. And when we talk about mosquito-borne illnesses, West Nile virus is pretty endemic now in the area that we expect to see it every year. But it's really triple E, Eastern equine encephalitis, that is really a dangerous disease. So every year we work closely with the state and with regional entities to monitor that. And when they do get sort of animal cases or mosquito pools that have that, we sort of step up our response. Usually tends to be later in the summer by the time we start to see it in, again, either animal populations or mosquito populations. But they're out there, we're public health, right? So we're always prevention. So EJ did a great job sort of summarizing what you can do to protect yourself and your pets from bringing in. Oh, I did want to add, so sort of, we treat a lot of our pets to avoid ticks, but they can still carry them on them. The tick won't bite them, but they'll bring it, sometimes they'll be a carrier to bring the tick into the house, and then they bite us, the ticks.
Interesting. I
But
never thought of that, because my dog takes a tick pill once a month.
yeah, so the tick doesn't want to bite the dog because of that pill, but sometimes they catch a ride indoors on your pets.
But why don't we have pills? I'll take a tick pill.
You
Really?
You can't even spray in Brookline. I don't think people are going to want to take tick pills, but they're
But
not for humans.
are there tick pills for humans?
Well, they're working on a vaccine for Lyme, which is tick-borne illness. AJ, I don't know if you know the latest on it. I know they have one for pets, but they're talking. There's not much funding for it because it is so endemic, which is unfortunate.
Oh,
right. Yeah, some other parts of the world do have one, but it's not used around here at this time. And I do get a lot of questions too about testing for ticks. So if somebody finds a tick on them, that's actually, to my knowledge, not something that DPH does. There are facilities around the state that do tick testing. There are some issues with it. People typically, they want to get a quick answer as to, did this tick carry any particular illnesses? Some of the issues, it's not uncommon to have false positives or false negatives. Even if a tick is carrying a certain illness, it's no guarantee that is a tick that bit you or that it transmitted that disease to you. There's sort of no guarantee. So, it's sort of, the information is not always useful. If anything, if you do find a tick on you, I would just recommend getting in touch with your provider, especially if you do develop any symptoms like a rash, fever, muscle or joint aches. Get right in touch with your provider and they'll sort of advise you where to go from there.
Oh my goodness, you all are so busy. So busy. You must sleep very well at night. This has been absolutely fascinating. And we haven't even gotten to food insecurity, which I know is a problem in Brookline as elsewhere. So you want to take the last couple of minutes, Sigalle and Elizabeth, and talk about food insecurity?
Sure. I'll take that plug to talk about our farmers market coupon program. So we are in the third year of this program, where we provide eligible residents with coupons to bring to the farmers market. And this is a great way to provide healthy food at low cost, really no cost as long as they use the coupons. But also help support our farmers markets. So talking about nutritional food options. So that's a great program. We are just at the tail end of registration, but if people have questions, they can contact the department to see if they can get access to the food coupon program.
Where do they register? Online? And what if they can't? What if they're seniors and they have problems with online?
Yep, we would say call the health department, and we can
Okay.
connect you to the staff that handles that program.
Do you have anybody seated at the farmers market who could help people or explain? Do you have a table there?
Yeah, actually new this year, there's a sort of a town table. We will be at that table once a month, but we are sharing that responsibility with other town departments, so we'll be rotating through.
Good.
But I would say the number one way to get access to the program and for information is to call the health department. But we will be at the farmers market once a month, doing actual registration for the coupon program.
Well, Sigalle Reiss and Elizabeth Bennett, this has been a real eye opener for me. I am certainly going to call my provider and ask for a tick pill. And I don't care where in the world they're using it. I want it right here on Winchester Street. Thank you so much. If there's any way we can help you, the Domestic Violence Roundtable can help you, please reach out. And I hope you'll both come back again. Good luck in your endeavors because they're enormous what you're doing. Thank you so much.
Thanks for
Thank you
having
for doing this.